Thank you all for attending today's webinar, Going Beyond Community Benefit. We'll be together for the next 28 minutes or so. I really want to focus on how health systems and health departments across the country are really driving a broader impact and how you can do that as well with your next community health improvement plan. I am Will Snyder. I'm the co-founder and CEO of Metopio, and I'm joined by one of my favorite people in the health space, and that is Nancy Lim. She's the Director of Community Health Improvement at the Catholic Health Association. So you can see quite a bit about her extensive portfolio and great work on the slide here. The team at the CHA is, I think, very innovative. They're really thinking about impact beyond just what's reportable in the IRS 990 form for nonprofit hospitals. They foster and facilitate a lot of collaboration and discussion between health systems, health departments, and community-based organizations, and thinking about that collaborative impact. And Nancy has just a remarkable CV herself. So she's done work in clinical nursing, hospital quality. She's worked in the advocacy and public policy space, was very involved with CHA's effort recently around trying to stem the Medicaid cuts that went through the federal government. And she's also, I agree with this point, completely. She's very good at building consensus among member hospitals and partner organizations. So with that, let's jump in. The chat should be open or will be open shortly. So if you have any questions, go ahead and add them. But Nancy, excited to get started.
Yes, thank you. Thank you for that wonderful welcome.
Yeah. So, we're talking about impact today. And so as we go through this, here's what the agenda looks like for the webinar. So I'll just give a quick refresher so we're all on the same page about the kind of impact we're talking about resulting from health assessments. I'll turn it over to Nancy. She's going to talk a little bit about the obligations and also the opportunities that both local health departments and hospitals have to drive broader impact. She's going to give some great examples from the field that look at both collaboratives and individual efforts, and then really kind of talk about how you think about designing your CHIP for that larger impact, or designing your full community health strategy. Then at the end, we'll have a few minutes for discussion and answering any questions that you all might have. So just a very basic, quick refresher. The virtuous cycle is what we sometimes call this. So do your community health assessment. If you're a health department, a community health needs assessment. If you are a health system or hospital, often folks follow the MAP 2.0 process, which is part of the accreditation process for public health, and then also just a really thorough and solid process for anybody to follow. Out of that, there's the obligation to create an implementation strategy, which will address the needs that were identified in that health assessment. That implementation strategy then gets done, implemented, and then when it's completed, you think about evaluation and starting the cycle over. And really kind of what we've been thinking about at Metopio is, go back to this quickly, is with the community health assessment and the growth of technology or tools and technology to help really get a hyper-local focus, how can people start thinking about subpopulations, think about issues not just in a larger thematic way of like, oh, it's substance abuse, but really trying to drill into who is most impacted, where's the greatest burden and the greatest impediments to access, and getting that hyperlocal focus, I think, ultimately will help create a more effective implementation strategy. That said, implementation is still very much of a challenge across the industry and across the public sector. And so here are a couple of reasons why. I think there's a misunderstanding and a misalignment. I think probably many of you on this webinar today have probably had questions come from your board of directors or elected officials saying, well, what have you done? Like what's going on here? Why do we still see this problem? And I think some of that comes from a lack of understanding that, if we're really trying to address some of the systemic issues that come from generational poverty, we're not going to solve that in a 6-month or 9-month program. That's a multi-year effort that's going to require a large collaborative to get the work done. Similarly, there's oftentimes a lack of ownership. So a program might be run by a community health worker in one instance, a nurse at another facility, A health department might design a program slightly differently in a collaborative than the health system. And without that kind of clear line of ownership, it's hard to really get measurable impact. And then, I'm guilty of this. I think it's probably happened to a lot of us. You get to the end of end of an implementation cycle, and you're like, oh man, we didn't have our evaluation framework set at the beginning. So how do we try to shoehorn our impact here at the end? And what happens then is you often just look at outputs and not outcomes. So you're saying, well, we gave out 100 Narcan kits, or we, screened 500 people um, for disease, diabetes, and that's that. But if you've got your evaluation framework on the front end, you're actually going to be able to then think about that as an outcome and not just the numerical outputs. And so, that's why we built Metopio. We're very much focused on solving these problems and a technological framework, but also really excited to work with thought leaders like Nancy. And Nancy, I'll turn it over to you to talk about what the CHA is seeing and doing in this space.
Great. Thank you so much, Will. I'm so excited to be here and talk about community health improvement, public health. For those of you who are not familiar with Catholic Health Association, we represent the more than about 650 not-for-profit Catholic hospitals and 1,600 long-term care and other health facilities across the country. Not-for-profit Catholic hospitals are the largest provider of care in the country, with 1 in 7 patients being cared for in a Catholic hospital every day. And for more than 35 years now, CHA has been the leader in not-for-profit community benefit. Community benefit aligns a lot with public health, community health improvement, and we have a plethora of resources and tools around assessment planning and reporting that are many available to all free of charge. So next slide. So thank you for inviting me.
Absolutely.
So let's talk about not-for-profit hospitals, right? There's more than just the community benefit or the collaborations. Not-for-profit hospitals impact our communities in many ways. And here's the three primary areas. First and foremost, their primary charitable purpose is to provide acute and urgent care, a lot of times also chronic and preventative health care. And we want our emergency rooms. We need our hospitals, because when you need them, you really need them. The other way is through community benefit. There are a lot of activities that benefit the community. Only certain ones meet the definition and qualify as community benefit to be reported on the IRS Form 990 Schedule H. And so that's a specific type of activities. And then there's all the things not-for-profit hospitals do that are above and beyond their primary charitable purpose, and then the IRS defined community benefit. All of those together are impact on how well and how long we live. And it lines nicely with what public health does. So in the next slide, let's look at those requirements. So local public health, if you want to be accredited, you have to do the needs assessment in that cycle that Will went through every 5 years. For not-for-profit hospitals, we're governed by a few different rules as a 501c charitable organization, but within the Internal Revenue Code of 501R is where our requirements for the needs assessments and the implementation strategy and evaluation lie. And like the requirements for accreditation, both of the organizations are required to do assessments and an improvement plan. Timelines are just a little different. Unless I heard in Ohio, the Ohio State Legislature said, oh no, local public health has to do every 3 years to help work together. Both of our organizations engage the community, and we embed health and health for all, and thinking of health in that broader term in all of our actions. Both of us are interested in what's happening because of the work we're doing, that evaluation and that continuous process improvement. So yeah, Will, I've been guilty of that shoehorn too at the end, like, oh no, what do I write in this report? But we're seeing many people move to a continuous process improvement approach, so you can see where you are ongoing and make those adjustments for improved health along the way. both of us report and communicate. And the great thing is our missions from the very beginning of both local public health and hospitals is about serving the community and building a community where all can be who they were meant to be and have the optimal health that they can achieve and the health and well-being. So next slide, let's look at some examples. I'm so excited about these. So the first example are really about these collaboratives where public health, not-for-profit hospitals, and a variety of community-based organizations that are service-oriented come together as a community to do the needs assessment. And here with Healthy by Design in Billings, Montana, they actually do a community CHIP. I think I've seen a lot of community CHNAs. I think that's one of the better practices is where communities do them all together. Seeing a community CHIP, I see a lot of coordinated CHIPs, not necessarily a community CHIP, but this is a great model. And they have this whole coalition and they come together. It, it does hold each other accountable, but what they're doing is working together collaboratively and measuring how things are working out together. Other organizations, there's what is it? Healthy Baton Rouge. And then there's the Columbia Willamette in Portland, Oregon, that also have similar strategies. And there's a lot of them that, there's a whole list. But this great collaborative model is wonderful. Now I want to go to one hospital that works in collaborative, but when they write their individual implementation strategy, as we call it from the hospital side of view, but it's a CHIP, they're writing their implementation strategy, looking at kind of those three different ways that they're impacting the community. So they're not just writing about the community benefit stuff that they're doing, right? Here we have an example, and their CHIP is available if you look up Christus St. Vincent's in Santa Fe, New Mexico, and you look up their CHNA or their implementation strategy, because that's what they're listed under, you can see this is their behavioral health. This is a priority need. And they have their objectives, but they start with what are we going to do in our primary charitable purpose, their direct care service line, to address behavioral health. So here's what we're going to do inside. Then they have what are we going to do that counts as community benefit? And what's our strategy within there? And then I really love this part because this is the collaborative, this is the above and beyond. How are we supporting other organizations, our local public health, our local government, in the efforts that they're doing to address behavioral health, and so that all can have the highest possible behavioral health. So I really like this combination. It reminds me of the social ecology of health. It's kind of those three areas that we saw that are turned on their end. This is a great example that I lift up a lot. So let's go to the next slide. And why I always, right, if you're in public health, I don't know about you, Will, but I'm always going, right, remember the triangle, remember the triangle. I think we learned that the first day, but right, our triangle of the social ecology of health, where it's right, individual, organizational, community, and policy, right, public health, we're all about this. And we know that when we push on all those areas to address a need, we're more likely to have a greater impact, right? Because the decisions I make as an individual are impacted by the organization around me, the community and the culture, and then those policies that we have in place. And today, for another discussion, we can talk about the other side of the triangle about building the readiness for change. But look how nicely that lines up with the three different ways hospitals impact the health of their communities, right? There's the care at the individual level, there's the community benefit, and then there's all those other things above and beyond. So together, right, the problems that we're dealing with, right, if it was easy to make all of us healthy, we would have done it all by now and hopefully retired and on a beach somewhere or wherever we love to do things, whatever we love to do. But these are hard, sticky problems that are impacted by a lot of systemic issues. And so they're going to take us working together, and they can take a long time. So understanding impact and the little advances and celebrating those along the way are really important for sustainability, for persistence, and for just being sticky and staying there. So let's look at the next slide and let's look at some of these in action, right? We talked about in Catholic not-for-profits, 1 in 7 patients were providing that emergent care, but we can see mobile clinics, and here that's Arch Care in upstate New York, reaching out to farm workers in collaboration with Catholic Charities, who's doing navigation, getting people into health exchange plans and food, and really looking at those social needs. Respite centers, I don't know a community that's not dealing with an issue of having places for people to go and recover that are experiencing insecurities in housing and respite centers. We've seen a lot of these come up, and they're wonderful programs to provide care when needed, when people are transitioning between the hospital and moving to home or a more permanent place to live. Our hospitals are addressing some of those social needs, food insecurity. Actually, in the bottom with the gentleman standing with the food cart, that's a program from Common Spirit, where they were looking at their food waste and their impact on the environment. And what it ended up doing was creating a program to address food insecurity, because the food that they couldn't use or didn't use for the day, they were able to partner with a shelter or multiple shelters to provide that food in a healthy way, nutritious way, to expand the number of people that were able to eat outside of their facility. And so it was a wonderful program that started as, let's look at what we're throwing out and how we're impacting the environment, but then contributing to the health in another way. And then we have programs that are addressing some of the anchor strategies. FMOL with payday loans, they're helping their employees that are financially insecure, housing, how we buy things. So there's a lot of different ways that we can partner. Next slide. And I think, are we kind of out
There
of,
we go.
so
Thank you.
evaluation, right? It's all about the art of the good question, not what did you do and it's time for a report, but along the way that impact, that continuous process improvement, asking ourselves, did we do what we said we would do? And is it having the impact we wanted? If you're a results-based accountability organization, you ask, how much did we do? How well did we do it? And is anyone better off? And if we're really thinking about that human flourishing and health for all, great questions that I love are who's benefiting, who's burdened, who's missing, and who's deciding. So while those are reflective questions that I use, this is tough work, evaluation and impact reporting. It's really tough,
Yeah.
but it's worth it.
Great. Nancy, fantastic as always. Thanks for that great overview of some real world experiences tied into just kind of the general framework. I want to take a few minutes to open it up for questions. We've got a couple already, and I've got a couple, so I'm going to ask mine first, just out of selfishness. I'm just some technicalities, and then we'll get into the larger questions. But you mentioned community chips. To me, that's a really interesting idea, because you're right. It's like the trend is collaborative CHNAs, which combines resources, puts less burden on the community to provide data and input and so forth, so you're not repeating over and over and asking vulnerable populations keep showing up to focus groups or fill out these surveys for all these different entities. But can you help us understand the community chip? Like, what I see there is an ownership challenge, and that's something that we talked about. Like, who owns the impact here? So how have you seen those work when you have multiple stakeholders owning a chip?
Yeah, so in Billings, what they do is they have the backbone and they really work together. They are continuously, right, all the things from a collaborative that we have where they are continuously talking, they're sharing data, and they're looking at it. So they're looking at what they do continuously. That's why in some areas, in Healthy Baton Rouge, they don't have a community chip. But what they do have is organizations do their chip. And, we saw St. Vincent's and Santa Fe's wonderful model. But what they do is have a coordination of where they come together to look at who's doing what, so that they're not competing and they're actually helping. So I would say both of those, right? It depends on what works with your community. I don't think one is better than the other. I think, there's some organizations that are like, I don't want to write down what other organizations are doing in my chip because I have no span of control over that other organization. And like you said, from an ownership standpoint, I don't own that. I don't want that to cloud up so that we can stay focused. But it's that coordination effort and being committed to it that really sparks the community. So if in your community, they won't do a full chip that's all together and everybody's in there, that's okay. Because even if you have that, like you said, it's the ownership. How are you coming together to see what's happening for the community? Because the community's at the center. And
Yeah.
so whichever way it works, but having somebody who calls you and who's asking those questions, that's what you need.
Gotcha. Yeah. Thanks for clarifying. It's a great point. And I think, one of the things we've been thinking about with the chip module within the Metopio platform is around, like, we can pre-build a logic model for clients or for users. And there are a lot of folks who are doing more collaborative work, or they want to say, we want to deploy this program across 4 or 5 hospitals in our portfolio. And it's really important to understand that you have to make sure your logic model then tracks the same way in order to measure that impact. So you can deploy the program however you want, but your outputs and your outcomes need to match in order to be able to understand that impact. So there's that's kind of like federalism, like you have the state being able to say, we're going to do this with this directive from the federal government. So we got a couple of great questions. One, kind of building on this collective impact, which is, this is from somebody working at a children's hospital, and they consider collaboration opportunities. But children's hospitals serve a specific population, children, pediatric population. So do you have any thoughts or insights, Nancy, on how the fear they have of a collaborative approach in CHNA and CHIP is that children often get lost in that process when you're looking at the larger population. So any thoughts or insights on how this might be considered, or if there are other children's hospitals with recommendations based on their own work?
So I think I would tell a children's hospital, don't shy away from collaboration when you're working with other organizations that are dealing with a broader lifespan. And actually, in Santa Fe, I haven't looked at their CHNA in a while, but they take a lifespan approach at looking at all the different needs. And so, right, I used to work in early childhood policy. Start early. There's not as much to do. If you get a good start, wow, things really can go wonderful. And if you get a late start, it's so much harder to help children that didn't get a start or when they're as an adult. So if you're identifying needs, then look at what's very specific for within your demographic and the age spans of what can be done, and really supporting the families around, because we know we're a community species, right? We need each other, and children especially need their families. They need the people around them and their communities. So all of that impacts. And use your voice and just speak up. Okay, well, what are we going to do for children, and how are we looking across the lifespan, especially at those ends where people tend to get forgotten?
I think we can follow up offline with this question too. We've got a couple of examples of where a children's hospital participated in a larger collaborative, and then committed to the goals of the chip, but then noted that they had to run separate programs, that were tied to alleviating poverty, but with a focus on vulnerable children. So yeah, it is a tricky challenge when you start to think about specific populations that might not sync with the larger collaboratives focus.
Right.
But yeah, great.
And children's hospitals there may be some community-based organizations that have that issue as well when you're really looking at a larger collaborative approach. So it's kind of the same issue.
Yeah. So next question, you mentioned continuous process improvement as kind of a new direction that a lot of folks are going. So what is that looking like? What examples do you have of how health systems or health departments are thinking about this ongoing cycle of improvement and measurement?
Right. So, hospitals have to every year fill out that Schedule H, and within it, you have to say what you did within the last year to improve the health of the community. So right there, every year at least, you're going to have to stop and say, at least shoehorn what you did in a year and the impact. But it starts with the CHNA and the building of the implementation strategy. You talked about logic model building, right? And when you're building your logic models, you're looking at how are we going to know we're doing what we said we were going to know, and how are we going to measure that impact? You're making those decisions. And then deciding how often are we going to look at this? So is it monthly we're going to look at what we're doing, or quarterly? I mean, quarterly may make more sense as opposed to once a year. Where are we with this? And yes, some of our metrics are old, like 2 years old or something. Some of our metrics, like it might be hard, but it's the process of getting into coming back, touching base. Where are we? Is this working? Is it not working? What needs to be tweaked? And so we're seeing that over and over again, really the commitment to looking at it.
Excellent. Yeah, that's very helpful. And I think something we probably want to dig into in a future webinar, just that very
Yeah.
specific tactical process of process improvement. So we have time for one more question. It's an easy one to answer, I'm sure. How do you ensure multi-year chips don't get deprioritized as leadership or funding changes happen? Very appropriate given the uncertainty around public health funding this year and sort of the ups and downs that folks have experienced. So what are you seeing work for being able to keep the focus while you have leadership and funding changes?
Yeah, so leadership is really important when you have leadership changes. Make sure you get to know the new leadership. I think the continuous process improvement and the continuing of telling your story, having regular reporting and updates that you're sending, whether they're required or not required, like here's what we're doing. Make sure that you have a connection to your board or some leadership, so that you're continuing to give a report or update on where you are. That's what helps keep it kind of alive. With not-for-profit hospitals, right? This is a governance, this is compliance. It's our mission, first and foremost, but it's also compliance. And so it's getting that in front of leadership that's helpful. And building it into orientation so people know why we're doing what we're doing and what the requirements are. And then celebrating. I think celebrating, Will, right? I don't know if that's one of the
Yes.
things you say a lot.
Yeah, it's summertime. We should be celebrating. Well, thank you so much, Nancy. I know we're at the top of the hour now. We'd love to stay in touch with everybody. We've got a poll that just popped up if you'd like to sign up for our next webinar. We're going to send out some resources. So Nancy was very kind enough to put together some tips from member hospitals around the CHA network, as well as some resources so you can understand kind of what Krista St. Vincent was doing, as well as the Intermountain and Billings collaborative. But we'd also love to learn from you all. So if you have interest, please reach out. Would love to understand more about what you're focused on, pain points you're encountering, and thinking about how we can create some learning collaboratives and cohorts among this great group of participants. So with that, thank you, Nancy, very much for joining us. This has been a delight.
It's been wonderful. And I saw a question in the chat. Yes, that's the chip that I was talking about.
Oh, perfect.
So
Yeah, we'll
yes.
make sure we circulate that.
So
So
thank you so much for this opportunity. It's always great to get together with you, Will. Thank
absolutely,
you.
Nancy. Well, have a great day and enjoy the remaining month of summer or so. So see you soon.
Bye.